Hi, everyone. Thank you for coming. My name is Michelle Perugini, and I'm the co-founder and CEO of Presagen. And today I'd like to discuss social networks as an approach which has been highly successful for media with Facebook and Twitter, and for video with YouTube. And I'd like to discuss how social networks can solve some of the biggest challenges in healthcare, particularly with a focus on women's health. When we talk about women's health, many still say it's niche. Why is that? Women are the primary healthcare decision makers in the household. They do the majority of healthcare spending, and they represent half of the world's population. That certainly does not sound niche to me. Possibly unique and definitely underserved. And therein lies a huge opportunity to create impact. The women's health market is estimated at $60 billion annually. But when you consider all of the specific women's health areas like pregnancy and menopause and ovarian cancer, as well as other health conditions that affect both men and women but disproportionately affect women or affect women differently, $60 billion seems like a gross underestimate. Women's health has been largely misunderstood and undervalued. And what we need now is a new targeted approach in a system that has been historically designed for men. When you consider applications like precision medicine and artificial intelligence, their success really relies on data. They rely on good quality, globally diverse data to ensure that technologies can support all women around the world without bias. Data will allow us to better understand the differences and treatment between men and women, between female demographic subgroups, and importantly, identify better ways to address largely ignored female-specific issues. However, women's health has a huge data access and bias problem. Women's health issues are typically treated by small specialist clinics rather than big hospitals. This means that data is sparse and poor quality, as well as disaggregated and geographically distributed among many clinics globally. It becomes a massive challenge then to connect those siloed and private data sets held by many different stakeholders. At Presagen, we've solved the problem of connecting globally distributed and siloed data by using a social network model. So what on earth do social networks have to do with healthcare? At a basic level, social networks are a decentralized network with a globally connected user base. The social element of the network allows collaboration and sharing amongst its users. And the network grows via the network effect, which I'll explain in a minute. Importantly, it democratizes and shifts powers from large companies to the masses. For example, with YouTube, there is a power shift from large studios to anyone with a camera that can create and share videos. To explain this further, let's continue to use YouTube as an example. Users who are the content creators can create and share videos for other users who are the consumers. Content creators are incentivized by royalties on advertisements, and any user can be a content creator or a consumer or both. The great thing about social networks is the network effect. Content creators create videos because of the incentives. The more content creators on the network drives additional video content. The more video content drives more consumers to join the network and watch that content. And this in turn drives more demand for new content, which in turn drives more content creators to meet that demand, and so on, and the network grows. At Presagen, we're using the same social network model to access global data sets. Clinic users from around the world can share medical data with patient consent to support the development of AI healthcare products. These clinics can be of any size, anywhere in the world, which encourages diversity and allows anyone to participate. Clinics are incentivized by royalties on the future sales of the AI healthcare product that is being developed. And any clinics can be data contributor or a consumer or both. And because AI is so specialized, we have a technical team that does all the hard work in the middle, which includes the AI build, clinical validation with support of the collaborators, regulatory approvals, and product distribution through the global network. This model is also driven by the network effect. Clinics become collaborating users due to the incentives, as well as being involved in innovative products and publications. The data they contribute allows us to build additional products. The more products we build encourages more consumers or other clinics to utilize these products for their patients. And the additional consumers drives more demand for new products. So users drive which products they want and the expansion of the network into new verticals or industries. And the more demand drives additional clinics to become collaborators and so on. And the network grows and organically expands across different healthcare verticals or industries of great value. To make all this happen, there are significant healthcare data challenges that we needed to solve. We've created a global, decentralized cloud network that allows us to access these global data sets without ever having to move the data across borders or centralize the data into a single location or country, which many privacy laws do not allow. The data remains protected because it remains local in each region. And since we can't centralize the data for AI training, we use our own unique federated AI training algorithm that allows us to train on data distributed all throughout the world without having to move or see that data. And lastly, we solve the data quality problem with a powerful algorithm that can automatically and remotely detect errors in that data stored on our global network. So now I'd like to switch to talking about how we've used this social network approach to build our first product called Life Whisperer, which is aimed at helping IVF patients get pregnant sooner. Life Whisperer has 2 AI applications in market with authorization to sell into 48 countries. The 2 AI applications assess embryo quality, which is a critical part of IVF treatment. Life Whisperer viability assesses the embryo to identify which embryo is likely to lead to a pregnancy. And Life Whisperer genetics assesses that same embryo image to identify if the embryo is likely to be genetically normal. We also have a 3rd application in production, which is Life Whisperer oocytes, which applies earlier in the IVF treatment to assess the quality of eggs. This new application is also applicable to patients wanting to freeze their eggs in addition to IVF. Our global collaborative network is growing and is now at over 200 individual clinics globally, representing 18 clinic networks that are collaborating with us and over 100,000 patients across 13 countries. As the network grows, it also helps us to be able to access data faster and build products faster as the network effect generates momentum. Life Whisperer's AI is truly globally scalable and unbiased, which ensures that it's accessible and affordable to any clinic and their patients of any size anywhere in the world. Life Whisperer is currently being used in really advanced clinics in Europe and Canada, to small remote clinics in Trinidad and Tobago, all the way through to massive clinic networks like Indira IVF, which comprises over 100 individual clinics across India. Soon we'll be looking to diversify and start connecting users and their data to our collaborative network in other areas of women's health, starting with obstetrics and gynecology. Thank you so much for joining me. If you're interested in downloading this presentation, you can go to presagen.com. Thanks so much.